You're listening to the Dispassionate ADF Veteran's Voice. Each episode is generated and narrated using artificial intelligence, specifically Google's Notebook LM, drawing from official records like the Royal Commission Final Report, government strategies, inquiry reports, and lived experience accounts. The narration is delivered in American accents, as that is all that is available in this emerging AI tool. Don't let that distract you. This isn't the voice of any one veteran or organisation. It's Australia's veterans' story, told through evidence, not opinion. Here are your hosts.
Welcome to the Deep Dive. Today we're wading into, well, a really profound and urgent topic. The mental health crisis affecting serving and ex-serving Australian Defence Force members, and crucially, their families too.
It's something that's been brought into sharp focus, hasn't it? Especially with the Royal Commission into Defence and veteran suicide.
Absolutely. It's not hiding anymore. We're looking at a whole range of sources, official reports, yes, but also the really powerful lived experiences of people caught in the system.
And our mission today really is to unpack that, to look at the systemic drivers behind it all.
It makes people vulnerable.
Exactly. Things like PTSD, of course, but also moral injury, abuse, these deep psychological impacts. And then critically, we need to explore the path forward. What does an evidence-based approach actually look like?
And the sources seem to really emphasize lived experience in that solution, don't they?
Fundamentally, data is key, yes, but lived expertise is essential for genuine reform.
Okay, let's unpack this then. To really get a handle on the scale, we have to start with the numbers, I think. The data points to something called the transition gap, which sounds pretty ominous.
It is, and the figures are quite stark.
So what do they actually show? The difference in suicide rates between those serving and those who've left?
Well, look, the suicide rate for ex-serving males, and that's anyone who served even one day since '85, it was tracked at 31 per 100,000 per year.
31, okay.
Yeah.
And for those still in permanent or reserves?
That rate is around 13 per 100,000.
Wow. So it's more than double.
More than double the risk once you leave the uniform.
That transition point,
Mhm.
it's clearly a major vulnerability.
Precisely. And it gets even more specific. Certain groups face an even higher risk.
Who are we talking about there?
The data points very clearly to ex-serving males who separated involuntarily. So particularly those let go for medical reasons, or under this category, the ADF calls retention not in service interest.
Retention, not in-service interest. That sounds like, well, classic bureaucracy speak. What does it actually mean for the person involved?
Yeah, it's not necessarily misconduct. It could be redundancy, maybe performance issues that didn't warrant formal discipline, but the organization basically decided they weren't a good fit anymore.
So a feeling of rejection, perhaps.
Absolutely. Often rejection, abandonment, especially if it felt sudden or unfair. Combine that involuntary separation with losing your identity, your tribe. It creates this incredibly elevated risk.
It really underscores the unique nature of military service itself, the demands, the dangers. They forge these incredibly strong bonds.
Totally. Deep reliance on each other.
But when that structure, that environment, breaks down or betrays someone, the psychological impact seems to go beyond what we might typically think of as just trauma.
And that leads us straight into this concept of moral injury. It's something the Royal Commission really honed in on.
Right. Moral injury. How is that different from, say, PTSD? Is it about the type of event?
It's related, but distinct. PTSD often stems from fear, from a threat to life. Moral injury. Well, the sources define it as a kind of deep violation of your core moral beliefs, your sense of right and wrong.
So witnessing something, or maybe even participating in something, that goes against everything you believe.
Yes, or failing to prevent it, but crucially, it also involves the institutional response, or lack thereof.
Ah, okay.
When the institution defense, or later, the Department of Veterans Affairs, fails to prevent wrongdoing, or fails to respond properly when it happens, that failure itself creates this profound sense of betrayal.
Betrayal by the very system you serve.
Exactly. And that feeling of betrayal, the research shows, is independently linked to serious mental health issues and a significantly increased risk of attempting suicide. It's that feeling of being let down by the organization you dedicated yourself to.
Which brings us to another really difficult aspect.
Yeah.
The sources highlight the gendered nature of so much of this trauma.
Yes. Women make up about 13.5% of veterans now.
And they report just pervasive experiences of sexual abuse, harassment, assault, linked to what the research calls an entrenched masculinized military culture.
And this is where that institutional betrayal can be absolutely devastating. The qualitative evidence, the personal stories, they're just damning.
How so?
When women veterans reported military sexual trauma, or MST, the response they often received from the institution itself was, frankly, re-traumatizing.
Instead of support, they got
Blame, stigma, being labeled a troublemaker, being managed out, or as one source chillingly put it, just gotten rid of.
That's just a complete failure of leadership and care.
It is, and the pressure to stay silent was immense. Women were told explicitly things like, if you open your mouth, this will be the end of your career.
Forced to choose between their career and their basic dignity.
Imagine that psychological burden. It's institutional betrayal at its most corrosive.
And while women face these specific horrific abuses, this culture, it seems to suppress help-seeking for everyone, doesn't it? Particularly men.
Absolutely. There's a powerful vulnerability stigma that permeates the culture. For men especially, the expectation is to be strong, stoic, never show weakness.
So admitting you're struggling with PTSD or depression.
It feels like failure. One veteran described it really powerfully, just said it's like losing face.
That conditioning, that need to maintain the strong facade.
Mm.
It's vital in combat, maybe, but
It becomes a huge liability afterwards. They hide the pain. They suffer alone because admitting they need help feels like betraying that core identity of being a soldier, being tough.
in that silence, that isolation, it often pushes them straight into another source of trauma, which is almost unbelievable, the actual support system itself.
Yeah, the bureaucracy. It's a cruel irony, isn't it?
The Department of Veterans Affairs, DVA. The sources consistently point to it as, well, actually making things worse.
Yes, contributing to the onset or worsening of mental health conditions, and sometimes, tragically, with consequences like self-harm or suicide.
There's that phrase you hear. The claims process can be as traumatic as the original injury.
It's a phrase that should stick with you, yeah, because you hear it again and again.
But why? What makes filling out forms and dealing with DVA so damaging? Is it just red tape?
It's more than that. It's the sheer complexity, first off. Then there's the often adversarial feeling of the process, and the delays, the agonizing wait times.
How long are we talking?
Veterans report waiting months, sometimes years, just to get their entitlements recognized. They talk about lost paperwork, having to retell their trauma over and over and over again to different people.
That sounds incredibly re-traumatizing.
It is, and layered on top is this pervasive feeling, right or wrong, that DVA is actively looking for reasons to deny their claim, that they're not believed, that they have to fight the very system meant to support them.
And during that fight, that wait, they're often without income, without treatment access. I mean, those sources mention people dying by suicide while waiting.
Yes, friends of veterans have reported that. That delay, that lack of urgency, it just destroys trust. Even under the main legislation, the MRCA DVA's own targets allow for half of claims to take over 90 days.
And those are just the targets.
Those are the targets. Many wait much, much longer. When you are literally fighting for survival mentally or financially, and the system feels like it's fighting you, that's a profound systemic cruelty.
It really highlights this massive disconnect, doesn't it?
Right.
Between how defense brings people in and how it lets them go, this transition chasm.
That's a great way to put it. Think about joining up. You go through this intense process of cultural immersion.
Right, basic training, building that identity.
Exactly. You're molded, you get purpose, identity, structure for literally every part of your life. Then you leave, often abruptly, maybe involuntarily, and there's just nothing comparable.
No structured deculturing.
Very little compassionate, structured preparation for civilian life. Transition isn't just the day you sign out. It's a long, challenging journey. And that sudden loss of identity, purpose, the support network, that whole scheduled life, it creates this massive upheaval.
Compounding all the other risk factors.
Directly, going from that hyper-structured sense of belonging to, often, isolation almost overnight.
And who picks up the pieces? Often it's the families, right? Who are often left completely outside the official support loop.
That's been a huge historical blind spot. The system has largely operated on a veteran-only model.
But the family carries so much of the burden, emotionally, financially.
They absolutely do. And crucially, families are often the ones encouraging help-seeking. They're the primary source of hope for many veterans.
So the support needs to wrap around the whole unit.
Exactly. We need a fundamental shift to a family-inclusive approach. Families need access to support too, mental health education, maybe family therapy, practical assistance. You have to look at the whole family ecosystem, not just the individual member.
Okay, so given all these failures, trauma in service, during transition, from the bureaucracy itself, the Royal Commission's findings basically mandate urgent change, right?
Uh,
What's the path forward look like?
Well, the mandate is clear. Act fast on the urgent stuff for veterans and families, but also fundamentally restructure the support system around evidence, research-led programs, and importantly, accountability, measuring the impact on people, not just ticking boxes.
And a huge part of that proposed shift seems to be this focus on lived expertise,
Yeah.
bringing people who've actually been through it into the design process.
Yes. Individuals with lived and living experience of suicidality or navigating these system failures, they're seen as absolutely central to making things work.
Why is that so crucial? What do they bring that, say, clinicians or policymakers might miss?
They bring the reality check. They have the deepest insights into what works, what does not work, and what is missing.
Yeah.
It forces the system away from just seeing the individual as the problem.
Right, the deficit model.
Exactly, and forces it to acknowledge the social context, the environment, the systemic issues driving poor mental health. It's also vital for rebuilding trust. You need solutions designed with people, not for them.
But how do you actually do that? How does a huge bureaucracy like DVA genuinely integrate lived experience without it just becoming a token gesture? Another box to tick.
That's the million-dollar question, isn't it? It has to be authentic. The sources really stress that. But the potential benefits, especially with things like peer support, are immediate.
Peer support. People with lived experience helping others.
Yeah. And the value comes through so clearly from participants themselves. There's a great quote in the material. When you are met by a lived experience person, you may not need to worry about the person not getting you.
That instant connection. That understanding.
Precisely.
Yeah.
It offers validation, connection, things clinical services sometimes struggle with. Plus, it's a way to rapidly expand the mental health workforce with people who have that innate credibility.
So it all comes back to trust, doesn't it? Rebuilding something that's been so badly damaged. These new structures like the Veterans and Families Hubs, they need to operate differently.
Totally differently. Trust requires transparency, empathy, respect. Any new agency or hub needs a clear service promise, and they have to deliver on it. Simple as say what you do and do what you say.
And be local, visible.
Absolutely. Integrate that local, peer-led support. Be part of the community, not just another faceless office run from the Canberra bubble, as many veterans call it.
So wrapping this up, what does this all mean for you, the listener?
Yeah.
We've really seen this two-pronged assault on mental health. First, the initial trauma from service itself, PTSD, yes, but also institutional abuse, moral injury.
And then the second wave, the systemic trauma, the sheer difficulty, the delays, the adversarial nature of trying to get help through the DVA claims process. That process itself is an active factor in worsening mental health and increasing suicide risk.
That duality is key, isn't it? The first injury compounded by the second.
It really is. And it makes addressing that claims backlog, making the process faster and more humane, not just an administrative task, but an urgent clinical need.
Which leads us to a final thought, maybe a provocative one, about accountability. We hear huge figures being thrown around, hundreds of millions, billions for mental health reform, for reviews, for strategies,
Right.
long-term plans.
Yet the sources are telling us loud and clear that one of the most powerful, immediate things you can do to reduce suffering, to save lives, to start rebuilding that shattered trust, is simply process a veteran's claim faster, more compassionately.
It seems almost too simple, doesn't it?
So if that's the case, if the goal is genuinely to regain trust and prevent suicide, what does it really mean when the simple act of providing dignity and speed in that claims process remains such a persistent, monumental challenge? We're talking about a system where the cost of delay isn't just financial, it's measured in avoidable human tragedy.
You've just heard a conversation built and presented entirely by AI from official sources. No speculation, no shortcuts. From Royal Commission findings to lived experience, we're unpacking the veteran ecosystem. If this episode helped you make sense of the system or gave voice to something you've felt but couldn't name, consider subscribing and liking the channel. That way, you'll be notified when the next episode drops. Send a link to a mate if you think they might benefit from synthesizing the massive information too. We'll upload at least one a week, each tackling a major issue with clarity, dignity, and zero spin. There will be 10 main episodes and many more spin-offs. This isn't just a podcast. It's clarity that is easy to consume and will help to mobilize those who really care.